Hi, I'm Lydia.
And I'm Sarah.
And we're a team of psychologists and psychotherapists from Body Matters Australasia. And today we're going to be talking about the dangers of gastric banding being performed on patients who have clinical eating disorders.
Gastric banding is a medical procedure where a band is inserted into the stomach in an attempt to limit the size of the stomach. It's an adjustable band, the procedure is reversible, and when someone has this band in their tummy, they're more likely to experience a feeling of fullness earlier, and this is supposed to help them lose weight.
So it's important to acknowledge that currently in Australia, there's actually a lack of regulation of the bariatric surgery industry, and eating disorders are not actually considered contraindications for lap banding. We've actually known of many patients who have had lap banding procedures performed on them despite meeting the clinical criteria for bulimia and binge eating disorder. Binge eating is actually defined as eating an unusually large amount of food in a discrete period of time. It's usually done in secret and is characterized by a sense of loss of control. And binge eating is also often used as a method of regulating distressful emotions and involves a lack of impulse control. It is a psychological illness, and it's a core feature of both bulimia and binge eating disorder. It's not uncommon for patients who have bulimia and binge eating disorder to actually sit far above their natural weight. And for many of them, they do actually exist in the obese category, which makes them potential consumers of bariatric surgery. Now, one of the major problems with this lack of regulation within the bariatric surgery industry is that many times patients are either not properly screened for clinical eating disorders by their bariatric surgeons, or even when eating disorders are disclosed to the bariatric surgeon, they are still being performed on as though they are suitable candidates. And this brings up a serious problem. How can we possibly expect to fix a psychological problem with a physical intervention?
And I guess the key point here is that if these people suffering from these illnesses could actually stop binge eating, they would. But in fact, by having this medical procedure being undertaken, it actually places them at very high risk of further complications. It's really important also to know that a lot of the advertising for gastric banding is actually potentially quite misleading. The procedures looks very simple. It looks as though there's very little medical complications, and that's just not what we see in a clinical sort of setting. We're always seeing people who've had the procedures and had the surgery take place presenting with all kinds of other medical complications which really impact on their life. What sort of things have you seen, Lydia?
Complications that I've seen in patients include things like not being able to eat healthy foods because their lap band will not allow them to. Things like vomiting several times a week because binge eating involves eating past fullness, which is incredibly unhealthy to them. Also, things such as malabsorption of essential vitamins and nutrients. They're also at heightened risk of problems like bowel rupture, hormonal imbalances, and so forth. So despite this being pitched as a cure or some kind of appropriate treatment for people with eating disorders, it certainly isn't.
And I guess the thing is, as we've said, is that people, just by restricting the size of someone's stomach doesn't stop the urge to binge. And the urge to binge is coming from a psychological place, and it's not hunger that's driving binges. One of the issues is that people who experience binge eating are often pressured to lose weight. And what we've found in our clinical experience is that shifting the focus away from weight loss is much more helpful for people, because if they could lose weight, they would be losing weight.
And if they could stop binging, they would stop binging, but that's
the
part
problem.
of the psychological illness. So if you're someone who's concerned that you may actually have an eating problem, such as an eating disorder of some kind, and that your problem may be more psychologically or emotionally driven rather than physically driven, it's important, if you're considering undertaking lap band surgery, to actually seek out a second opinion, such as seeing an eating disorder specialist or psychologist prior to going ahead with a bariatric intervention.
And similarly, if you have undertaken gastric banding, and you have had this procedure on your body, then we'd also encourage you to get in touch with an eating disorder specialist if you're finding that you are continuing to experience symptoms of binge eating. So thanks for watching. We are Sarah and Lydia from Body Matters Australasia,
where every body matters.